on. Dr. Abraham, thank you
What's
so
up?
much for joining me.
Thanks so much for having me. I'm so stoked about this conversation. Definitely one of the highlights of my week. So excited to be here.
Same. Absolutely the same. I've actually told my spouse, I'm looking forward to this, but it's going to get real
Yeah.
because I've been very open about my fertility journey. We've been trying for about 2.5 years now.
Yeah.
And so I've been a little stalkish on your website. Just like, I'm getting a free coaching
Listen,
call tonight.
I I surprisingly get that quite a bit from a lot of providers. So trust me, you're in good company.
It's how common is it? I think I need to know just for myself because I'm going to tell you
Yeah.
right now, and you probably have heard this before.
Yeah.
I feel like I'm healthy. I work out
Mhm.
incessantly. And I've had a very dear friend and also physical therapist. She helps, in terms of tracking, just guiding women on their fertility journey.
Sure.
And as healthy, I'm vegan. I mean, I try to like use all of this to make myself feel good.
Yeah.
And through all of it, I started just feeling a little bit of trauma because
Yeah.
she would tell me, "You're really stressed these
Mhm.
days. Your stress level is high. Your resting heart rate was high." And I was just like, "What in the world?" And she would gently remind me, this is not the best environment to actually prepare
Oof,
your body for pregnancy.
yeah.
So I've been struggling. I'll be honest with you. Like my mental health
Yeah.
over the last year has shifted, right? So
Yeah.
how common is it for professional women, to be like, "Hey, what's up?" What's up?
I'm so happy we're starting off with this, and thank you so much for your transparency because I'm like we're going there tonight. I love it. I think that the research tells us now that in the Western world, 1 in 4 couples will go through infertility, and for folks who do end up getting pregnant, 25% of them will miscarry at one point in time. So it's a pretty high statistic, and I think if you look around and in a group of any group of women, you're going to see that most individuals, at least a quarter of them, would have gone through infertility or are going through it or may not know that they're going to go through it, which is crazy to think about. But I think for specifically, there's some amazing research about high functioning career women, especially African American women, and their experience with infertility. And I'll share just a study that I came across. The study came out about 3 or 4 years ago. So this is kind of around pre-COVID era. And it looked at the success rate of egg transfer for career women. And they looked at white women and looked at Black women. And I believe in the study group that the career women, Black women group that essentially received a donor egg transfer had a higher failure rate than their white counterparts. And if you think about just kind of like the layers of that, of course, the study didn't go too much in detail, but I kind of stalked the way that the study was discussed, and I had some really interesting concepts around implicit bias and the weight that a lot of women carry, especially Black women carry, and how that unfortunately translates into a very real experience with infertility. So there's a lot of layers to this. I think Black women in general, women of color are double minorities and carry a different type of weight. And then when we mix it into our biological abilities, it's quite fascinating what limitations we do run into.
Okay, so even if we are successfully able to, go through IVF, which egg transfer, go through all the procedures, 1 in 4 of us, women in general, not just women of color, 1 in 4 of us still have a risk of miscarrying.
Yeah. Yeah. And that's what a lot of people don't know is that you can still miscarry. There is SART, which is essentially a organization that gives us up-to-date IVF data. Typically every 2 to 3 years, they publish the data. And so we're kind of working through preliminary data right now for 2024. And it's really interesting because we're still seeing that sharp decline, that the older you get, the less likely IVF is going to work. In fact, some research that I came across, I believe, a couple of years ago was still saying that it takes couples typically 7 trials until IVF is 70% effective for them. And so,
7 trials
yes.
until 70% effectiveness is reached.
Yes. And so typically for most couples, if they're over the age of 35, typically we'll have a 23% success rate for one time. Yeah. And so we see that fluctuate each trial. So yes, IVF is a privilege because most people think, it's a one and done situation. But when you get into the weeds of infertility, you learn very quickly that, it is a process, it is a journey, and some people's journeys look very different.
I mean, absolutely. Like I'm inching towards student loans, but like, I mean, thankfully, like I paid off my PT
Yeah,
student loans, right? But I'm like, okay, this is stacking up.
it is. It
Like in
is.
terms of cost, like
Oh,
this
yeah.
is.
It
And
is.
so I mean, we haven't even tried IVF, and I'm thinking like, okay, just one IVF is gonna be about 75% of what we've already paid for all the
Mhm.
IUIs and all that we've done. So you're saying 7 on average, it takes 7 IVFs to get a 70% success rate.
Yeah. Yeah.
I did not know this.
Yeah, it's pretty staggering, right? And again, I don't want to be a damper because the whole essence of this conversation is hopefully to provide a lot of context research and honestly, because of who I am, some hope, right? To move forward. But I do feel like people need to know the facts, right? And it's not to say that IVF is not worth trying. I still think it's scientifically one of the best forms of, fertility support that we could have. But I do think that a lot of couples go in with very, very high expectations, and because we live in the Western world oftentimes, our medical relationship is often transactional. And so it very much looks like you take these pills, you come in on this day to take a test, we draw these hormones, and you get your result, right? When in actuality, if you look in the rest of the world, we talk about nutrition, we talk about exercise, we talk about stress management, we talk about village support, right? Those are all these things that really matter in addition to the more scientific medical interventions.
Okay. So make no mistake, I don't try to be a Debbie Downer in these talks because this is very real to me. It
Yeah.
took 6 IUIs for me to figure out that I should be looking at my fluid, that I should actually be
Mhm.
knowing what my fluid is, like what ovulation actually meant. When I went in, I was fully expecting to be educated.
Oh my gosh.
And I was, like, shocked at just how procedural it was, just coming on this date,
Yeah.
and when I finally switched clinics, they were saying, "What? You were coming in 34 hours after you had already ovulated to
Oh
get
my
inseminated."
gosh. What?
I'm not I can't lie about that, so when I'm, like, already 15, thousand dollars in, I'm thinking like, "Wow, I'm doing something.
Yeah.
It's just not taking," and in fact, I was completely being miseducated,
Hmm.
right? And so this is not is honestly for me, I think this is a gift that you're even given all, this information because the
Mhm.
rest of the world does do it with village support, nutrition,
Yep.
sleep health,
Yep.
sleep hygiene,
Yes.
not just sleep health, but hygiene, just a way of living and a way of preparing
Mhm.
your body for fertility. I didn't realize there was so much education. And the people that were with me, they also had never like
Hmm.
been educated about ovulation and phases of luteal phase, menstrual cycle, even just basic
Yeah.
reproductive education we didn't get.
It's wild that you're saying that because, I think that, and when I was having this conversation with one of my students who's taking a course of mine right now, and we were talking about her frustration with a lot of the patients. She's saying like, "Why am I the first one that is having this conversation with my patients?" Right? And I said because we should have probably had the conversation when we were in health class in ninth grade, right? Somebody should have told us that there was something called a follicular phase of our cycle and a luteal phase. And I'm a product of the era of teen pregnancies, and so oftentimes everything that was shoved down our throat was don't have sex, don't have sex. Here's some condoms if you're going to do it. So no one was actually telling us, well, at some point you want to know your body, you do want to have sex because you want to have kids, even if that's not tomorrow. This is how you know when you're ovulating, right? I wonder if we were appropriately taught more family planning language and discussions around reproductive health, if that could have actually avoided more teen pregnancies because the girlies would know when they're actually ovulating, right? And so I think that I will say it's never too late to have this conversation, right? But I'm big on, because I see a lot of women who are moms who are a little bit later in life. And I'm like, have these conversations as soon as you can with your daughters, because I think that any kiddo should know enough about their body when, they're teenagers and they're having an abundant amount of cervical mucus because of hormonal regulation issues at that age. They need to know what that is. They need to know that they don't have BV or yeast infection, right? But this is natural occurring vaginal discharge. And they need to know that that's really healthy that their body is doing that, right? And so I think that, of course, the girlies that have irregular cycles when they're in high school or they're playing sports, and instead of us just slapping on birth control, instead of educating these women, I think it's really important for us to have these conversations early on.
Dr. Abraham, I was that teenager. I had horrible cramps. And
Yeah.
so the family physician that we went to's recommendation to my mom was birth control, right?
Mm-hmm,
And
mm-hmm.
thankfully my mom was of that generation where is
Oh yeah.
you're not medicating. No,
That's
we're not doing that.
my
So
mom was
she
like,
learned.
heck to the no, she's not doing that.
Mm-mm. We learned very quickly, change up my diet. I mean,
Yeah.
at that time I was a dairy hog, so I was always like
Mm,
eating handfuls of cheese and a lot of milk and things like that. And so she changed my diet. She started giving me some things I don't even know. Like she would just mix up a whole bunch of herbs and things like that.
wow.
And she would massage my abdomen,
Wow.
even like in my teens. And I'm just thinking like now, I mean, we get into like the really exciting part of this conversation with pelvic health therapy.
Sure.
I'm thinking like my mother knew some things
Intuitively,
because
right? Mm-hmm.
like intuitively, because I remember my cramps change. I was the kid that would stay home from school
Oh,
once a month at least because of these bad menstrual cycles. So I wanna talk a little bit more about that because in terms of fertility and menstrual health, do you start early on with your clients, even teenage years or
yeah, I would say that I typically get in as early as college age these days, just because the
wow.
college girls are on Instagram, they're online, they're on TikTok, and they're typically hearing about their pelvic health. And so they get curious. I think the number one condition that usually gets them in the door is vaginismus, right? Is because typically they hear the stories on TikTok about, the nightmare speculum exams, and then they think, okay, I need to see a pelvic floor therapist. And of course, because the way that I do my evaluations, most of or all my evaluations rather, include conversations about menstrual health. I want to know what your cycle is like. They typically are like, what does that even mean? And that is the opportunity that I get to be able to correct some of those challenges that they're having. So I think that in pelvic health, and I'm just going to go ahead and kind of lay this out here. As pelvic rehab providers, we have a phenomenal, phenomenal privilege of being in the basic geography to make impact when it comes to reproductive health. And I use the language reproductive health because I do want to expand it to not just aiming to get someone to conceive, right? But the idea is we're looking at the entire life cycle, right? From puberty, from the time menses happens to the time it leaves and beyond, right? Because at every single junction, the reproductive changes are real and they can impact quality of life, sleep, sexual appetite, and habit. It can impact, the overall ability for someone to engage in society, right? If they don't, especially if you think about folks that have uterine fibroids and endometriosis, their reproductive health has really altered their lifestyle, right? And so I think that having that conversation kind of throughout that whole life cycle, like I love having the conversation with a lot of my perimenopausal folks who are like, why are my periods all of a sudden crazy? I'm like 42 years old and I love having that conversation. I'm like, well, there's something happening and we're losing estrogen and this is why. So as pelvic floor therapists, for sure, we should be leaning into the menstrual health conversation, the reproductive health conversation.
How many pelvic health therapists have you come across with training specifically in reproductive health?
None. None, Dr. Rebecca. That is why I'm here. I think, I really say this with all humility that I have felt drawn to this work because of the amount of ignorance in our field, right? And it got scary because for folks who may not know my story, I stumbled upon this specialty, I'll say that, right? I grew up having some hormonal issues. I actually grew up with a condition called Hashimoto's thyroiditis. So I had a lot of issues with my thyroid growing up. Had an awesome fire mom who would literally fire up any provider at any time. It was like always on site with her. Like she was asking all the questions and all the details. I really grew up having a mother who was a huge health advocate for me and did not allow me to get labeled, right? And so I think I accessed health with a lot of grit and a lot of forward thinking. And I also accessed health with a lot of holistic perspective at a very young age. And I think that as I was entering my career, remember the early years of my career as a PT, I was naturally drawn to gynecological problems. I thought, I'm seeing someone for pelvic floor dysfunction, but she's also got terrible periods. And I remember specifically, it was my first job. I will never forget. I was working in a private practice as a pelvic floor therapist, and I was working with a woman who she had a young kiddo, and she had a terrible, terrible delivery process. So I think her kiddo's around like 5 or 6 at this point. She's seeing me because she's got like tailbone pain, coccydynia, the typical kind of the kind of diagnosis you would see. But she also mentions that she's got painful intercourse as well as really terrible cramps, and she noticed that her periods were irregular ever since she had her kiddo. So I started kind of doing some manual techniques. At the time, I was not professionally trained in visceral manipulation like I am now. But I just said, you know what? It makes sense for us to release some of these pelvic ligaments. It makes sense for us to maybe see what your uterus wants to do. I remember finding the fundus of the uterus on my own on her and just working through it. And I was shocked that within 2 cycles, her periods were better. I mean, she came in with just tailbone pain and she left me, with tailbone pain improved, regular menstrual cycles. She restored her orgasms and having, really great deep penetrative intercourse. And, she felt all this level of optimism about trying again, right? Because the trauma of that birth and the reality of her body no longer feeling like a safe environment for her to have another baby just made her feel like she was one and done. And I was like, wait a minute. When I got through that process with her, I was like, let me try something else. And I remember I had another gal. She was 18 years old, irregular periods. I was seeing her for like pelvic floor dysfunction. And the same thing happened. And that's when I said, I think something is happening here. And at that time, we're talking about roughly 10 years ago for me, I did not really have a lot of guidance. I didn't know what I was doing. I remember speaking to my boss, who was a bit of a mentor at the time for me. And I was like, what is, and she wasn't a pelvic floor therapist, so she didn't know what the heck was going on either. And that's when I stumbled upon visceral manipulation and I got serious, and the rest is history.
Okay. We have to slow down. I'm very big on I honestly I try to teach to like the level of understanding of my family, not my
Yeah.
colleagues, right? Because we have histories of gynecological from cancer, from cervical cancer,
Mm-hmm.
from just different stages of pelvic pain, incontinence, all of that. And I need to break this down a little bit more because I really was going in the direction of optimizing fertility for women who never have been able to achieve pregnancy, like
Yeah.
myself. You're talking about in this first example, let me back up a little bit to the first woman. She had a traumatic birth
Yeah.
and she was harboring in her body that pain, the
Yes.
trauma of a traumatic birth, and she wanted to either get pregnant again or just achieve a normal menstruation,
Yeah.
normal cycle, all of that, but couldn't after her traumatic birth. And working with you, she was able to not only have regular menstrual cycles, everything changed.
Yeah.
Her health overall, all of it.
Yeah. The science of it is fascinating. And I'm going to break this down like I'm talking to one of my girlfriends who's like in IT or something, right?
Please do. Yes.
The science of it is fascinating. The limbic system, which is an area of our brain that stores and processes emotion, is very close in proximity to where we house our hormone, right? Where we make our hormones and send our hormones to. And a lot of people don't know this, but when you experience trauma, it does have an ability to impact you hormonally. And that whether that trauma is sexual abuse, whether that trauma is racial trauma, or if the trauma is experienced in a domestic relationship where you experience violence. There are many reasons why folks will have true reproductive like manifestations. I'll give an example. I remember, I mean, and I'm sure some of you have maybe have experienced this before. I remember some years ago, we got a kid at our church who was unfortunately shot at a gas station. And I remember going to the hospital to visit him immediately after this was happening. And his mom was there. She's in like a complete panic. His mom at this point is probably in her early 40s. And the first thing she said to me, Yeni, would you believe it? Like, I went into shock and my period started. Right? Now, if you think about it, her body's response to the trauma was menstruation. That is not the first time. You can look that up, gals. And you can see that sometimes our body's response to trauma is menstruation. Sometimes it's a stopping of menstruation, right? You'll have some women that truly have never been able to have a regular cycle after they had a loss of a child or a loss of a partner. And so is that all of it? No, it's not, right? We're referring just to some women, maybe a certain population of individuals who've actually had children before, right? But I do think that I will say about a fourth of my fertility population of patients are secondary infertility. And it's typically rooted in some level of trauma, whether that was some significant postpartum depression or psychosis, right? They did not have village support. So their body is literally fearing that process again from happening because it fears isolation. It fears the pain and the disassociation that it felt.
That's the term for it, Dr. Yene, is secondary infertility
Yes, that is
is
the term.
associated with something that's not directly related to a uterine issue or
It
uh,
could be a
a
uterine issue. Yeah. So secondary infertility can encapsulate all things, including uterine issue. It could mean that you stop ovulating, that your periods don't come back the way they should, but there's something that happened after you had an opportunity to have a successful birth that is no longer allowing you to experience that again. That's the simplest way that I can put it, right? And of course, my job is to help to investigate why that is. Sometimes the answer is really clear. It's all about restoring periods again, maybe doing some tweaking with some nutrition, some diet, and talking through some mental health issues, right? But I find that a lot of times folks are really just confused. They didn't even know how to have this conversation. It doesn't make sense to them why the first time they try to conceive, they didn't even think about it, right? They literally stopped their birth control the month before and got pregnant right away. And then the second time around or third time around, for some folks, they're struggling with conception, right? I'll share a quick story. I had a patient some years ago. She was literally one of my favorite patients. I think of her often. She was somebody who had a pretty traumatic C-section. So at the time that I'd seen her, she was 3 kids in already. So I'm like, okay, I'm thinking, why do we need to see me for infertility? But she's like, I think I have got some scarring. So I do my exam, and my God, Rebecca, she had significant abdominal scarring. I don't know if you've ever seen those older vertical C-sections, the one that come
oh, yeah,
right straight down to your belly, right? So we're
absolutely.
talking like right underneath where her bra sits, all the way to her pubic bone is
Wait,
significant scarring.
under her where her bra sits?
Yes. And
Wait, why that high?
the first question I ask is, why did they go that high? And so the first time, she said the first C-section she did, because she had some blood loss issues prior, as she was going into labor. So she said that the OBGYN at the time did the cut that way. So every time she'd have a kiddo, they recut in that fashion. And she mentioned having some hernia issues after her first child. So the cut just kept getting larger and larger. And so by the time I'm seeing her, she's got this really firm, immobile abdomen, doesn't actually have a lot of sensation, doesn't feel that I'm there, right? So my first thought as a pelvic floor therapist is, okay, I got to get to work on this scar, right? I got to work on improving these adhesions because her bladder is really malpositioned. So she's leaking. I can understand why she's not able to experience, some orgasm right now because there's a ton of scar tissue issues. So we get to work. I do some tweaking also with her diet, and I just say, clean up the sugar, increase your protein. Let's see what we can do. At the beginning of her third visit, she comes in and she says, Dr. Abraham, I took a pregnancy test this morning and I'm pregnant. And I said, the first thing I said to her was, that can't be true because based off of my clinical experience, I knew for sure we were in for long haul work, and it would at least take me several months, maybe even up to 6 to 8 months, for us to really feel like we were in the window for pregnancy. My goal initially was just to restore function, right? And by the way, the only reason why she wanted another baby is because she had 3 boys already, right? So she really wanted her girl. So she's like, I'm pregnant, I'm pretty sure. And I'm like, oh my God, send her to an OB locally. Sure enough, blood test confirmed it. Your girl is fully pregnant. And I thought about what happened, and I thought, was it really just a scar tissue? And I recall that one of the major things that potentially improved in her was that we got the uterus to move again. We got the ovaries especially to move again, right? That the ovaries just required just a little bit of relief and tension so that we can create some space. And potentially that's why we were able to see her ability to conceive. And then I always like to share this part of the story. So guess what gender she ends up having?
Stop, a girl, Dr.
Another
Yeni,
boy,
really?
another
Oh
boy.
boy!
Oh
Poor
my God.
boys.
And I told her, I said, don't you come back in my office asking me to give you another girl. Because she's in her early 40s. I was like, I was like, don't you call? She was like, don't worry, I'm done. I'm done.
This was the first time, just I'm trying to I'm in this office with you. This was the first time that this patient had anyone work on her scar tissue
Yeah. First time in all those years. First
in
time.
all of those years.
Yeah.
Dr. Yeni, you are demonstrating your range in this conversation because again, like I said, I was like, I'm focused. This is going to be a talk about women, and I'm thinking more primary infertility.
Mhm.
But you are showing range of working with anyone along the continuum
Yeah.
of women's health, right? Of pelvic health care. Have you found in your practice that in terms of trauma, there's more that you're doing that's not manual when you're first meeting someone who's struggling and trying to get pregnant?
100%. I'm happy that you used the word range because infertility is not straightforward. It
Yeah.
is complex. There's a range to it. There are a lot of layers to consider. I would say one of the first things I like to accomplish in those first few sessions is fertility counseling, right? I do sit with my patients. I do teach them how to track their cycles, what it means when certain figures are off. I try to make sure that I empower them with simple tools to know when they ovulate. I also like to make sure that individuals know what they should be eating. The research tells us that best practice is for men and women who are trying to conceive to switch to an 80% diet range of Mediterranean diet, right? And so we talk a lot about what is the Mediterranean diet? What does it mean to be eating, leaner meats? What does it mean suddenly eating some dairy, but eating lower amounts of dairy, right? And so we talk about that at length. And then, of course, we do some gentle cycle or do some supplement recommendation as well for them to look up on their own time, some supplements that I make recommend for them to do. And so a lot of that is really equipping people so that they can live a life that creates an environment for a fruitful outcome. I think that a lot of people, again, this is Western world, we have put fertility or medical problems in a box. And we don't realize that when you are looking to heal from something, you have to look at a multifactorial approach, right? You've got to approach it holistically, right? It's not just about, I'm going to take this pill to get my period, right? Because we all know oral birth control is not a real period, right? When you are taking oral birth control, you're getting withdrawal bleed. So your body is not having a natural opportunity to restore that function. And so that's a big thing, but I do spend a good chunk of time in behavioral counseling as well. And we talk about trauma. We talk about what it means for them to go through this journey of becoming a mother. A lot of my primary infertility folks who come to me have been incredibly disappointed by the medical community. And that in itself is a form of trauma they bring in. I have dealt with individuals who were skeptical,
Mhm.
individuals who are incredibly guarded, right? Rightfully so. Um, and I've also felt at many times that individuals that were almost they were taken for granted at a lot of points in their medical journey, right? And so sometimes it's also helping them to feel safe in this process, right? And then also helping them to realize that it is a process and it is a journey. And I know that, one of the biggest things that we kind of run into in the infertility world is time is of the essence. Like once they get in there, everybody wants to get pregnant right away, right?
Right. Yeah.
And helping them learn that we need to unlearn, we need to undo a lot of processes, and that may take time. That is such a hard conversation to have with someone who has thrown thousands of dollars into this process, who is several years in, and who hasn't really gotten the outcome they wanted.
Dr. Abraham, at the beginning of this conversation, I revealed to you that I was 6 cycles in of trying to
Yeah.
get pregnant, $15,000 in, and not one person talked to me about nutrition,
Yeah.
right? Whether I'm plant-based, vegan or not, I still needed a nutritional check-in in terms of like, what is the optimal environment for me to experience pregnancy, for me to get
Yeah.
pregnant, for me to have the most successful fertility journey that I could. I need to have a transparent conversation as we're bringing this full circle.
Yeah.
What is it about Western medicine where you feel like there needs to be a big aha moment starting very young,
Yeah.
and we need to bring some of these traditional practices, all of the traditional practices, honestly, that we have in the non-Western world, all around the world? Why do you feel like that's important? What are you seeing in Western medicine that makes you really uncomfortable?
Yeah. I think as you were asking this question, I was just thinking about one of the biggest qualms I have is just how segmented and broken our system feels. I feel like individuals get different versions of their condition from different providers, and none of it is making sense. It's inconsistent knowledge. I do think that also in the Western world, providers are very conservative. And what that means in plain language is that providers typically hold back on what they're willing to do to trigger your body, right, to be able to produce follicles. They're not able to give as much medication. And a lot of that is centered on money, right? We're talking about dollars and cents. We're talking about money that is attached. I have seen some providers, give a fertility protocol, and every line item, every drug, every intervention has a dollar amount to it. As a consumer, as somebody who is looking to become a parent, when I'm looking at that, I'm seeing that every aspect of this process has a value to it, right? And has a dollar amount. And am I able to come up with that money, right? And so I think that it, again, is very broken in that it doesn't really put into context all of the other things that are just as important as the interventions, as the drug therapies, as the IVF procedure itself, right? I'm also grieved because we are losing in the United States the honor and the value of holistic medicine. I think in the United States, Western, especially traditional Western providers, conservative providers, look down on Ayurvedic, Mayan therapies, massage therapies. They look down on all forms of alternative therapies. That's why they call it alternative therapies. The things we call alternative in the United States are often considered regular medical interventions in other countries. It's not until since recently, in the last 10 to 15 years, that we've even embraced acupuncture as being a normal part of an intervention in the fertility journey. Isn't that wild?
That is so wild. So I did learn this about my mom because, been very open about this. She had a massive stroke about 3 months before I started PT school. And so a lot of what I learned about her, I learned from my older sisters, which are 20 odd years older than me. So my mom started again,
Wow.
right? Not a problem with fertility. But she was actually seeing an acupuncturist and just doing all of these holistic things that I feel like, oh my gosh, like where did we go
Where
off?
did we
Because
go wrong?
where did we
Exactly.
go wrong? Like, why did we stop a lot of these traditions? And so when we now bring it back to pelvic health
Mhm,
therapists,
mhm.
right? Do you find the pelvic health therapists that you're teaching
Yeah.
seem almost a little like
Hesitant.
hesitant?
Yes,
Yes.
that's the right word, because they're scared. They're scared of going into the holistic realm because let's be honest, there's still a little bit of a taboo in being a medical provider and believing in embracing holistic practices. And I myself do draw a line. I don't think everything holistic is spot on. I think some of it is a little bit of a placebo effect, right? But I do think that there's enough out there that is valuable, right? Especially in the fertility world. So I'm Dr. Rebecca, I'm Nigerian by background, and I speak a lot about like our postpartum practices. After I had my son, my mom came over, my aunt was living with us, she stayed with us. They were feeding me all kinds of meals. They were doing massages to my belly after I had my son, and they were using warm compresses to help my milk production. These are just like natural things that we do in our culture that help to relieve and improve postpartum journey, right? And so a lot of people joke like, "Oh, did you need a doula?" I didn't really end up needing a doula because I was doulaed by my mom and my aunt. I had all these amazing aunts in the church and bringing me all kinds of soups to eat. And I felt replenished. I was able to go through that recovery process, right? And a lot of us are missing that in the United States because we don't necessarily have cultural practices to lean on, right? There are a lot of communities. I live in Texas and I practice in North Texas. So I am like spoiled with the amazing Mexican community up here. And I learned so much from them. And one of the main things that typically happens is when you're going through infertility, you go get a womb massage. Like it's just what you do. And I always love having those conversations with them because there's always like that, oh yeah, my mom wanted me to go see somebody in Mexico who does womb massage. But I just figured since you're here, I'm gonna go ahead and access care with you. And I'm like, I love that. But in the US, we are so scared of that, right? And so one of the first things I think I teach, especially in my fertility cohort, is like, hey guys, we're going to take the limits off of everything you thought you knew. Okay. And I want you to trust in your gut, trust in your instinct, and lean into the unknown because there's a lot out here that you may not know of or may not fully believe in yet that is working.
Okay. It's so funny you say that because I was treating a nurse practitioner and I was treating her while she was pregnant. And then I saw her within the first 6 weeks after birth in her home. And it was a little while later because she was having fertility issues that I very much saw her going the
Mm,
Western route for. And she did. She got an IUI, she did the hormones, she did all of it. But it worked the first time. She wasn't on number right now, it's
mhm,
11
mhm.
for me.
Hmm.
And what she told me, because up until that point, she had only told me the fertility clinics that she went to, like the hormones that she took, all the things
Yeah.
that she did, the ultrasound that was, 400 and up just for the ultrasound. What she told me later on was that she had found a man, he only spoke Spanish,
Oh
but
my
he had
God.
helped women in the community. He was of Mexican descent, and she was doing these massages with him. She called it Mayan massage.
Yes.
I'm telling you, Dr. Yeni, I had you on here for me. This is a private
Oh, look at
I know
God.
we have a lot live audience that you can't see, but, I'm
Mm,
telling you this because
mm,
this was just at the turn of last year. This was just the fall of 2023, and I'm here thinking she had done all these things the Western way. I've
yeah.
done the Western way, and come to find out, she had started meditation. She had
So good.
started seeing someone, for acupuncture. She had started with this
Wow.
Mayan massage with this man who didn't charge any money. He
Mm,
wanted to help women get pregnant. And I'm thinking like, okay, there's something to this.
yeah.
And I started stalking you around that time because I'm thinking like, first of all, you're
Mhm.
not only doing this for women, you're teaching therapists
Oh,
and
yeah.
requiring our education to also give someone the gift of bringing in life.
Yeah, because 'cause I'm not here to gatekeep. I'm big on spreading this knowledge because Dr. Rebecca, I cannot be in all these 50 states at the same time, in all these countries at the same time. So, and the thing is, once I saw these sequences and these interventions working in my office, the first thing I thought was, how are we going to get this out here? How are we going to save women all this money? How are we going to make sure that these marriages are held together and they're not broken because of how visceral this infertility process is, right? And that's why I teach. That's why I'm so passionate about teaching because I'm like, you got to know the information. I'm telling you right now, my clinical ethos is mixing in Western and holistic approaches. I believe marrying those two do wonders for us. I don't think that one or the other is the only way, right? And I'm thinking about you. I'm just going to lean into some of the stuff that you shared with me here. The ethics of 11 IUI bother me, right? Because that tells me that someone along the way hasn't pulled you to the side and educated you and told you that we could do something different, right? And I am often, I'm telling you, I could get emotional about it because
Mhm.
I'm often being the first person, that my patients see, that I'm pulling them to the side and say, this is not working. Like these providers are essentially treating you as just another number in their clinic. And I've worked so hard in my career so far to develop a strong and trusted network of providers that I know that I can send patients to any day, who are going to lean in and give them solid research and resources, and are not going to just treat them with an IUI after an IUI, right? Because if the body is not responding to that, then likely there are so many other things that we need to consider clinically.
Have you had any therapists, because I'm being honest with you, have you had any therapists who have decided to take your training for themselves?
Oh, yes. I would say at least 10% of everyone I've trained has come right
Wow.
out and told me I'm in it because I'm dealing with infertility. I've had some people say I'm in it because my twin has infertility, my sister, my cousin, and I just feel like I need to know what to help them with. And even though I never think, we don't want to just get trained for ourselves, but it's sure as heck good motivation, right?
It
Um,
is. Yeah.
I personally have gone through infertility. I have shared my infertility journey here and there. I went through quite a hellish process. I do not wish what I went through on anyone. My problem was quite different. I didn't have the issue getting pregnant, it was staying pregnant. And so for me, I've been on the other side of that as well, where I've been very disappointed by the medical field. I often share that as somebody who is a provider who had the language. When you're in a vulnerable situation where you keep miscarrying, or in my case, I had even lost infants at one point, had a multiple gestation pregnancy that resulted in preterm labor and the loss of my children. And I remember being in that scenario and feeling so disenfranchised, not even having the language to advocate for myself. And I think, I often say that the woman who I was before that process and the woman who I am now are completely two different people. I feel like that day, that version of myself died with my kids, and I became another version of myself, right? And I think when I got up from that experience, I said, to hell with everything conservative and safe. This is not working, right? This is not working. We need more than what we're doing right now. We need to equip women, we need to give them language,
Yeah.
and we need to stop acting like, at the end of the day, that they're crazy or they're losing their minds if they want something outside of what is traditional Western medicine, right? Because this is not working.
Dr. Yeni, I don't know. Where I am right now, I can say that if I were to get pregnant, but then have a miscarriage or a stillbirth, right? I don't think that, I'll be honest with you, I haven't even prepared myself, right,
Mm,
for the journey that I'm on right now. And so to say that that part died with you and that you became a different person, I can see that in so many facets. I can see this, there's so many meanings in that.
yeah.
And you have me hooked. You are holding me, you're holding an audience that you can't see. And I am thankful for them being here with us live. I want to know more. I want more. You run this fertility certification course for
Yeah.
pelvic health therapists. Do you run it for providers? Do you
Yeah.
run it for doctors, for DOs, for NPs? Tell me about your training.
Yeah. So I would say the hallmark training that I have available is the pelvic rehab fertility specialty certification. And essentially it is open to MDs, PAs, NPs, DOs, PTs, and OTs. Essentially any individual of those individuals who want to specialize in the pelvic rehab fertility side of things. And It's a comprehensive training. It takes about 10 weeks to complete the online version. There's an in-person technique lab that you get to take. There's a post-test and a proposal that we accept in regards to a case study. And essentially the idea is we certify you and we make sure that you are poured into and equipped to support this population. A lot of what I spoke about, that holistic side and the Western side, kind of is infused in the education, so you get a good balanced approach, right? Outside of that, I also have the lab techniques that I also teach. So I have in-person labs all around the country, and I recommend for pelvic rehab providers to take the labs, come to the labs, learn the techniques, right? Even if you're not really fully committed to be a specialist, come and learn so that you can apply this to your population. I have, and I say this respectfully, I've had so many providers say, I will never treat the same. Like after taking these courses, I am not the same type of provider, right? Because you don't learn what you learn about hormones and learn about the reproductive process and ever see your patient with prolapse the same.
Okay. Okay, even so prolapse, so even after birth or even after
Oh
pelvic
yeah.
floor dysfunction, you're saying that pelvic rehab therapists who take your fertility education, because this is for fertility,
Yeah.
you're saying that they're able to treat a wider range,
Oh
but
yeah.
differently, different approach, different mindset, different everything.
1000%. First thing I tell you is I know that you came in here to help your patients get pregnant, but that's not all you signed up for.
Yes, let's go.
That's not all you signed up for. I'm making sure that when you see somebody with uterine fibroids, you know exactly what you need to be doing. I want to make sure that when you see your endo patient, that you're not just going to be finding their obturator internus and releasing it, right? You are going to go deeper and you're going to make sure that they leave you feeling completely wholly, healed. Because we all deserve that. We really do deserve to be seen as a whole person.
Dr. Yeni Abraham, she is the owner of Triggered Pelvic Physical Therapy in Dallas, Texas. I do have to give just some forewarning. When you are on her website, the course is in a different location. Dr. Abraham, can you guide our listeners of where they could actually find this certification? Because it took
Yes.
me a little bit to
So it
realize.
is triggeredacademy.com. My academy is completely separate from what we do at the practice. So triggeredacademy.com. I have so many cool courses, got master classes to help treat your patients with endo and adenomyosis. I've got little courses that'll help you, figure out what to do with your patients who have fibroids. And we've got some cool courses on there. So it's triggeredacademy.com. And then, of course, you can sign up for all of the labs. I'm still going to a handful of cities. I think I have about 4 cities left or 5 cities left this year. And so I would love to see you in person. I'd love to, connect with you and pour into you and serve you. And so, yeah, come find me.
Dr. Abraham, we were streaming tonight on LinkedIn, Facebook, Twitter, as well as YouTube.
Oh my gosh.
And I love holding myself accountable. So I say this open in public and live, is that the cost of your program, your certification program, is a fraction of what me and my spouse have spent trying to get pregnant over the past 2.5 years. And you have embraced me. You have absolutely been a wonderful guest. This is an investment that is a no-brainer for me, because I'll be honest with you, I'm 38.
Yeah.
Right? I know what my chances are, but if I could give the gift of reproducing, of life to someone else, to bring in life to this world, to me, that's a no-brainer.
Yeah.
So I will be signing up for your course.
Oh,
This is on air. I will
goodness.
absolutely be signing up for this training
Thank
in
you.
2024. I'm
Yeah.
holding
Yeah.
myself to that and holding myself accountable,
Yeah.
because it's a fraction of the cost and of the pain that we've been through as a couple. And so you've been speaking to me tonight, and thank you so much for your time.
Thank you so much. And 38 is a special age. I'd say that's the average age of my fertility patients. So you are in
Really?
that sweet spot. And we can talk the rest off air.
On that note, have a great night, everyone,
Yeah.
and thank you
Yeah.
for joining us. Thank you.
Thank